Welcome back to the show. For the millions of Americans suffering from type 2 diabetes, there is hope. In fact, our next guest says that with the right treatment, it can be reversed. Here now to tell us more is Dr. Craig Hartman from Hartman Clinical Nutrition. Hi, Dr. Hartman.
Hello.
Let's talk about diabetes a little bit. We're going to focus on type 2 today. What other types are there?
Well, there's mainly type 1 and type 2. Type 1 is an autoimmune type of disease, meaning that your own immune system attacks your pancreas and really limits or totally stops your production of insulin. So those people have to supplement with insulin. Type 2 diabetes, on the other hand, is actually what we call insulin resistance, meaning that your body produces insulin, but it doesn't respond to it. And with that type of diabetes, it's not an autoimmune condition, and it's really the type of diabetes that I focus on.
Is it more prolific now? I hear about diabetes a lot these days.
Well, yeah,
and why?
Well, it's a condition that just keeps growing and growing. You know, there's well over 20 million Americans that suffer from type 2 diabetes, and one of the main reasons you see it to be so prolific is that typical treatment that people get is focused on really just suppressing symptoms and not really on finding a cause, not getting to the underlying cause. So what happens is these people start taking medications, and it's just a never-ending medication, and it allows it to gradually worsen. So, and that's one of the biggest misconceptions with the disease, is that nothing can be done, that's just a train that once you're on it, you just have to keep going. And which it isn't true at all. There are steps that can be taken to reverse it.
Oh, well, you talk about taking a different approach to treating diabetes. What makes yours different?
Well, what I do in my office is when an individual comes in, I'm actually going to do some real extensive testing of that individual, looking for underlying causes. And when we identify those underlying causes, we can then put together an individual treatment plan that actually handles or works to correct those underlying causes, and that's when the real magic starts to happen. You start to see positive changes in their condition.
Let's talk about some of those changes. What might a typical result be from one of your patients?
Well, you know, patients that I work with, you know, their blood sugars start to go down and stabilize at much lower levels. They'll also start to see weight loss that they couldn't lose before. They'll just start to naturally happen without dieting, because now the blood sugar gets into the cell and it changes the metabolism. Your body can burn it off rather than converting it to fat. We also see that they can start cutting back on medications. They start to have more energy. Really, they start to feel better overall.
If someone is watching right now and they're having, or they know someone who's having frustrations from their current treatment, what should they do? If they give you a call, what happens?
Well, really, when somebody comes into my office, we're going to start by evaluating them to see if they are actually a good fit for the office, see if they meet the criteria of our office, and then we'll do if they of course meet the criteria, then we're going to start doing the testing procedures that we do, looking for that underlying cause and really finding the source of their frustrations. And once we find that, then we can start, you know, an individualized treatment plan for them.
How long might that process take generally for people?
As far as, well,
getting through the testing and then starting some kind of treatment.
Well, we'll start right away, and the initial testing, some of them we can get back in a couple days, some take a few weeks, but there's the first steps we start right away once we get them into the program, and within the first month they'll start noticing changes.
All right, before we go, we've got to talk about a free offer that you have.
Yes, for the first 25 callers today, what I'm offering is a free consultation. They can just call my office and set up a time, and we'll sit down with them, and if they qualify for the evaluation anyway, we'll do a free consultation with them.
All right. So let me tell them how they can find you. To find out how Dr. Hartman can help you with your type 2 diabetes and more, you can just call him at 952-884-1850. Now from self-defense to the best defense against diabetes. Our next guest says that with the right treatment, type 2 diabetes can be reversed. Here now to tell us more is Dr. Craig Hartman from Hartman Clinical Nutrition. Hi, Dr. Hartman. Welcome
Good morning.
back.
Good morning.
Why is type 2 diabetes so prolific?
Well, it's one of those diseases that just keeps growing every year. It's been growing for the last 20 years or so, and I think one of the main approaches or main reasons for that is the typical approach is where they're using medications to just lower the blood sugar, but not really looking for the underlying cause. And so that just allows that disease, I always say under the hood, to just kind of get worse and worse and worse over time.
So you've talked a little bit about the typical approach, and your approach is different. What is different about it?
Well, what I do in my office is we look for that underlying cause. So we're going to do more testing. We're going to look to see what is driving this condition by testing different organ systems that are involved. And then what we do is we individualize a program for that particular person and what's causing it. And by doing that, we can then start to see an improvement or actual reversal of that condition.
Well, when you talk about improvements or reversals, what have your patients told you that's happening to them?
Well, it's a lot of fun. You see people where they're starting to get their energy back. You know, these people are many times very, very fatigued, so they start getting energy back. They're finally able to lose weight without dieting because their body, the internal processes start to actually work properly. So they're losing weight, and of course their blood sugars start to lower, they start to stabilize, and of course that's the main goal there. And then that's, you know, the reversal of the condition. Is
diet in our youth, in our younger kids, promoting this diabetes as we go through life, or what's making all this snowball?
That's a very good question. There's a variety of factors that really play a role in it. Diet, of course, is huge, very, very big. But other things, stress, really affects our body and how it handles blood sugar, so that can trigger it. A variety of different triggers can be found. Even such things as parasites could cause it, and just a variety of things. But diet is huge. It very much is. We have our fast food diet, and of course that makes us much more prone to diabetes.
Propels us into some of these problems.
Oh, yeah.
When patients come to you with frustrations, what are some of those frustrations?
Yeah, patients are frustrated because they keep getting worse over time, and the only thing, they go to their typical doctor and the only thing they get is more and more medications. I had a lady about a week and a half ago on 20 different medications. Wow. And it just keeps getting worse and worse and worse. Their blood pressure goes up, their cholesterol goes up, and the medications, you know, work well for some, but other people they don't, and that's where we really need to find that underlying cause.
All right, so if someone came to you, what are the criteria for taking them into your process of care?
Well, we really look at, you know, are they going to be somebody that's going to get a result with this type of program? So we're going to look at their motivations and how severe their condition is and make sure that they are the right fit for the program. Then we make sure we can get good results with them. Now,
you've got a special offer for people who are viewing right now. You want to talk about it?
Yeah. For the first 20 callers that call our office, we'll do a free consultation, sit down and evaluate where they're at in their care and really see if indeed they are a right fit for this type of program.
All right. Well, I'm going to tell everybody how they can get in touch with you and find out more about it. Nice to see you again.
Yes, you too. Thanks.
To find out how Dr. Hartman can help you with your type 2 diabetes and more, call 952-681-2916.